Hi, I'm Jan Howell, Division Director for the Indigent Healthcare Plan with Polk County Board of County Commissioners. And I'm here to tell you a little bit about the county's amazing Indigent Healthcare Plan, which was voted into being in 2004 with a 1/2 cent sales surtax. At that time, in 2004, the voters decided to provide healthcare services to their friends and neighbors. And last year alone, around 30,000 people who were at or below 100% of the federal poverty level received those services in Polk County with that money that's been set aside. Those people are people that are directed to primary care providers, specialty providers, and hospitals here in Polk County, as well as local community programs and volunteer clinics, free clinics like Lakeland Volunteers in Medicine, the Lake Wales Free Clinic, the Haley Center, and programs of that nature. We are pleased that as many people have received services as they have with this past year, and I'd like for you to hear more about that from the people who provide those services and from the people who receive those services, the members and citizens of Polk County.
All the services that are helping patients stay healthy, stay employed, and keep taking care of their family. I also know that there are 350 physicians signed up to the Polk HealthCare Indigent Healthcare Plan, and 5 of our major hospitals participate. That coordinated care takes really a lot of caring, a lot of emphasis on keeping the person healthy. We also know that having a well-organized indigent healthcare plan helps leverage more dollars to be invested into Polk County. That's really important. Those are outside dollars coming in to Polk County, not only to help our citizens, but to help employ folks to provide that care. That's a major benefit. It's a win-win situation. And with good health care, it'll help people avoid the emergency room and avoid hospitalizations.
So what we hope to do through the healthcare plan is provide continuity of care for chronic diseases in a non-emergent setting, because we can help reduce overall healthcare costs to the community and divert those precious emergency resources for the true treatment of emergencies.
The Polk HealthCare Plan provides health care for eligible plan members based on health plan industry standards for quality of care and cost efficacy. The winning stakeholders include the members, providers, and taxpayers.
At J-Care Medical, the ability to provide health care to the indigent health plan patient population is rewarding for us. We're very happy that we're able to serve these folks, and without the indigent health plan it wouldn't be possible, because a lot of these folks wouldn't otherwise have access to be able to come into our office and receive all the primary care services that we offer.
We are a group of professional individuals, volunteers, and community leaders that assist men and women with life-controlling issues, move them towards successful, independent living. Because of their previous situations, healthcare is a very huge part of the mix. This is a population that has pretty much had very little or no services before, and it provides a level of hope and acceptance for them, moving them towards their goals in life.
We are one of the Baptist clinics in the state. There's like 33 of us now, 34. So we're under the 501c3 or under the church's banner, but we are providing primary medical care. And we've expanded that primary care now to include specialists that we are very fortunate to have, like GYN or rheumatology, neurology. I have cardiology, nephrology, I could go on and think, oral surgery for some of the abscesses. But the whole mission is to meet the needs of our community that we live in.
Polk HealthCare Plan Associates work in collaboration with our network of participating providers in accordance with plan policies and procedures to ensure members receive quality care.
So the quality of life really is something that we have to work towards to enable. And whether it's a person who's down on their luck or whose employer doesn't provide them a lot of benefits, we really look towards maximizing their potential. All of our health potential is not the same, but we really work on maximizing the individual's health potential.
Teaching is a huge part of our clinic here. At discharge, we take our time and do one-on-one so that we can try to educate that patient as much as possible, along with following all the standards and the guidelines that's for every disease that's written, and following CDC guidelines. I mean, their focus is something different every year. As their focus changes, I'm looking at, okay, where can I implement it here so that we can give the quality care that we want to give. And our doctors are all quality care driven.
The Indigent Healthcare Plan provides the opportunity for us to assist more individuals and give them a chance for hope and change. Without it and our community partners, we would have a growing class and a growing drain on our costs in regards to health care in the county. This small percentage helps us to be able to assist with our community partners, the ability to be able to help more people in a more economic climate.
Case management by nursing personnel ensure that members' medical needs and care are coordinated. The Polk HealthCare Plan's member services continue to keep members enrolled in the plan to ensure continuity of care.
So in order to be eligible, individuals must come in and provide proof of their income for the past 3 months, and that income must be at or below 100% of the federal poverty level. They must be a Polk County resident with an intent to remain. They must have limited assets, $2,000 for a household of 1, $3,000 for a household of 2 or more. They must have a valid for employment Social Security card and a picture ID. They'll come into the office and they'll do an interview with one of our many case managers or eligibility specialists. That process normally doesn't take very long. It takes about an hour, where they provide all the documentation of their assets, resources, and income. During that time, the eligibility determination can be made, and their eligibility would begin either the 1st or the 15th of the following month.
I feel that our people do an excellent job, and that's blowing my own horn, I'm sure. But as a citizen that works in this county and also understand the type of clients that we serve and the members that are here, the need that is here, you know, what better people that would be awesome to provide this type of services other than the ones that work in it, have worked in it in the past. Maybe it has stemmed through the old Polk General Hospital and through our various clinics that we've had. We understand the medical need. We understand people not having. We take pride in knowing that we are the ones that providing it for our people who we live with every day, who we interact with, you know, whether it be in the grocery store or at the hospital or, you know, clinics where we go to the doctor. They are going to the same places that we go to, and we take pride in knowing that they're receiving that type of care just the same as anyone would through the private sector.
The purpose of the plan is to provide health care to qualified eligible Polk County residents who are not covered by health insurance and do not have any other health insurance benefits available to them. Ultimately, the Polk HealthCare Plan improves the quality of life for those who need it most.
Oh, Polk HealthCare I wouldn't know what to do without it. I'm diabetic. They paid for my insulin, which is outrageous. I have cancer. They paid for the mastectomy surgery for me. I couldn't even get a mammogram without Polk HealthCare. I couldn't do anything without any type of insurance. And Polk HealthCare, with it being no cost, is just a godsend. It saved my life. It definitely saved my life this last year.
So being that I have Polk HealthCare has been a blessing because I've been able to go to the doctor every month and get my medication at a reasonable price, whereas I wasn't taking my medication because I couldn't get it or couldn't afford it. So it's really helped me because I'm now can get my medication, so it's helping me keep my blood pressure under control, as well as they give me like different little techniques and different things to do to help keep my blood pressure under control. And as far as the lupus goes, that's managed by taking medication and seeing your doctor on the regular. So it's kept my pain level down, which has kept me from going to the emergency room so much.
I thank God, you know, for Polk HealthCare. There is I don't know what I would do personally my own self if it were to go away, because I've got COPD. I haven't got a confirmation yet that I'm cured, because that takes time, you know, through test zero levels, you know, over a certain period of months. They consider it cured. But I've got issues that require inhalers and things like that if you were to buy over the counter, costs $40, $50, $60. I could say reasonably and honestly that I owe my life to this coverage. And that's no exaggeration. And that's, I hope somebody will take heed of this, that I'm not the only one.
Since 2004, the partnership between the Polk HealthCare Plan, our community, and local healthcare professionals have helped low-income patients and been responsible for huge savings in healthcare services to Polk County citizens.
My hat is off to whoever came up with the idea. And I think it's a wonderful idea. I think, and it'd be the first thing I probably would say, thank you very much for, doing this for the community, and ask how I can help them continue it. I definitely am very much into indigent health care. I don't think they're any different than anybody else. I think they have needs the same as everybody has a need. Whether you have insurance, Medicare, Medicaid, whatever, there is still a medical need that needs to be addressed.
Anybody that has the power to keep it going, please, you must keep this going, because so many people's lives do depend on it. So many people's ability to function depends on it. So I mean, to me, it's indispensable. It's absolutely indispensable.
The greatest thing about the Polk HealthCare Plan is that it is a community investment. So this was a decision by the taxpayers of Polk County to, through a half-cent sales tax, to invest in the healthcare of the community at large. And the healthcare plan is one aspect of that, and some of those resources also go to provide support for other indigent healthcare programs across the county. So the fact that this community decided this is an important thing for us to address, and this is a way that we can do it, I think is a good model for other communities across the state.
Well, elected officials have done so much into listening what the entire community says and then representing them in important places like county commissions and state legislatures. And elected officials know that in our community there are people suffering with the bad economy, with individual events that can occur, and knowing that their government has taken the step to help them and organize it so that the funds are used efficiently. Taxpayer dollars are scarce. They need to be used effectively and to help people in measurable ways.
Not knowing all the details of what lies in the horizon, we do know that if we continue to operate our program with two goals, high quality health care to our members and attention to the stewardship of the monies of the community, that we'll be doing the right thing regardless of what that future entails.
As you have heard, there's an amazing amount of work accomplished to improve the lives of Polk County residents through the Indigent Healthcare Plan. With over 30,000 citizens helped last year, we are saving money while saving lives.